Namaskar. Myself, Dr. Ranjit Pratharao Patil. I am professor and HOD in Kai Chikitsa, Ayurvedic Internal Medicine in Ayurvedic Medical College, Petradagaon, Maharashtra, Kolhapur, India. Today I am here to specify some of the importance related to perimenopausal women's perimenopausal syndromes as women of perimenopausal stage. I am a brand ambassador and also a consultant working for global wellness platform Nourish Talk. That platform is well designed for the wellness of the postmenopausal women or perimenopausal women. Also for the wellness of men and women. I am here to evaluate the relation of anemia with the menopausal age going women. It is after 45, from 45 to 50. That's what the age is prescribed in the medicine books. In the Western countries, after 50, the HRT, hormonal replacement therapy, is given for the women. But in India, through Ayurveda, which is a holistic approach and a holistic science and a wellness subject, which illustrates, which throws light on women's health, and that evaluates regarding the use of Ayurveda and all the various herbs for the wellness of woman. Rutucharya and Dincharya, preventive aspects, hita hitam sukam dukkam, ayutasya hita hitam, swastasya swasthya rakshanam, ayutasya vikar prashamanam. To prevent disease in the swasth vyakti, to promote health and longevity in swasth vyaktis. That is what Ayurveda states. So that's what we have to do. So we are doing here the same thing on Nourish Talk Wellness platform. This platform is very useful for all the men and women of all age, not only for postmenopausal syndrome, but women of all age. So basically, I am a MD in Ayurveda, having clinical experience of 19 years. Also, I am doing PhD in diabetic neuropathy. So in the further videos, I'll explain the role or the relationship between the menopause and anemia, menopause and diabetes, and menopause and osteoporosis. So first of all, in this video, this is an introductory video, the first video I'm making for Nourish Talk. So we are working on the concept of menopause and anemia. So menopause have many stages: luteal phase, mid-luteal phase. So these phases, reproductive phase. So these phases are going for women, and with various stages of the menstrual cycle. It is of 28 days. So when the women approach the menopausal syndrome, then the duration of the symptoms are varying. For example, as in the women of age 45-50 years, in some women the menopause comes at 45, in some women it comes at 50. So there is a perimenopausal syndrome in which the women experience fatigue, lassitude, general debility, anxiety, insomnia, loss of sleep or less sleep, and a sense of fear, and general weakness, just all. So these are the perimenopausal syndromes. So these symptoms are elevated by medicines, and the medicines are given through the endocrinology. Endocrinology is a special branch of the hormonal treatments to the patients. In the Western countries, we go for hormonal replacement therapy, HRT, but India, we have to do the counseling of the women. We have to go for symptomatic treatments. So like hormonal treatment, or we can go for the depression treatment and various things. But in Ayurveda, this is wellness approach with the use of the various herbs like ashwagandha, shatavari, brahmi, yashti madhu, and chatavansi. So these drugs will act good in women. So anemia is very important thing, because the women of the childbearing age, they require more HB, they require more nutrition. Nutrition therapy is an important concept in women. Regarding the nutrition concept, the foods that a woman consumes, or nutrients like macro and micronutrients, are very essential. Trace elements, minerals, and all the vital amines like vitamins that are important in the woman's age. In Ayurveda, we prescribe the rasayana therapy. So if the pathophysiology we go, the women of childbearing age from 25 to 45 or after 45, what happens exactly? between the childbearing age, women has less nutrition. They neglect themselves, especially Indian women who are working towards the family, and they face severe anemia or to moderate to severe anemia, not mild but more. So in which they require the parenteral therapy for the iron. And regarding the medicines, so regarding the medicines, they require the overall maintenance of the good health. So consumption of balanced diet to increase the basal metabolic rate BMR. So the proteins, carbohydrates and fats must be consumed in well quantities. Also the fruits and vegetables must be consumed in well quantities. Also they must use proper diet therapy to increase the HB, because even on the consumption of food materials, fruits and vegetables, the iron is not absorbed properly from the body, and they may lead to anemia or malnutrition or pernicious anemia or any iron deficiency anemia or megagastic anemia. So for the proper absorption of iron on the foods, there are certain factors like Cassell's intrinsic factor, vitamin B12. Also, they must consume various food items that has those required amounts of trace elements or minerals or vital amines. That is what are required for humans. So the anemia is a major issue in such women. So because the cycle, the menstrual cycle, there is normally 3 days bleeding in the women. So it may be 1 to 3 days is normal. Some women face more bleeding, 4 to 5 days. So there may be dyspareunia, or there may be painful menstruation. So many things are there. So they lose the blood during the menstruation, and also due to the negligence towards self-development, self-health, for the family caring matters. So the women neglect eating proper food. So that is the thing. Proper exercise, meditation, yoga, that is required. So there is anemia. But in menopausal, perimenopausal syndrome, the women, they have more irregular cycles, more bleeding. So they lose anemia, HB, blood. Because also many vital amines like vitamins, like B12, they require B12, which is taken from the animal foods. Some women don't consume animal foods, so they lose vitamin B12. B12 is such water-soluble vitamin which requires carrier to our blood. Especially they require some sign like vitamin B12 is cyanocobalamin, cyano and cobalamin, cobalt mineral and amine is protein. So that is required by women. So women forget to take that in proper quantities. Also the stress, women have stress. Stress reduces hemoglobin in the body. Stress is a very harmful factor for reducing hemoglobin in the body. So that is also important. Also no proper diet, no proper exercise, walking, running, jogging, aerobic exercise, that are important for the proper maintenance of the body and for the proper circulation of the blood. So that is also there. Second thing, smoking, alcohol intake, that must be avoided in women's. Stress, proper sleep must be taken, because the proper sleep of 8 to 10 hours helps to increase the hemoglobin, helps to maintain the health of the heart and brain and kidneys. It is also required. Second thing, the women must be doing pranayam, yoga, meditation exercises mentioned in Ayurveda for the proper mental health, because mental health helps in the proper physical health of the women. That is required. Also, we must require to see that in perimenopausal syndrome, women are experiencing irregular periods, more bleeding. So that loses the HB, and so they have to compensate for the bleeding through other means, like consumption of dates, palms, consumption of green vegetables, consumption of red colored fruits and vegetables. That is very important in Ayurveda. Samanya Vishay Siddhant, that red fruits such as pomegranate, red vegetables, radish, carrot, beetroot, tomato, which has lycopene, which is antioxidant, which helps to increase the blood. So that is very important. So pathophysiology of anemia is clearly related to menopause or perimenopausal syndrome. Okay. So many factors like the digestion factor, the immunity factor is also related to the proper absorption of iron from the intestine, because if the proper absorption of iron takes place in the body, the consumption of iron from the fruits and vegetables in the women, that will lead to the increase in HB. So that the women must take care of. So there are many factors that I'll state in the next lecture. So thank you for patient listening. Thank you. Have a nice day.